Welcome back to the new norm. I'm Dr. Lou Graham, and this program is brought to you by Midway Dental and Catapult Education. So I wanted to bring Susan back for a part two because everybody loves these in 15 and 20-minute increments. So Susan now has gone through the teledentistry consultation, the in-office experience. So Susan, walk with me now on how you're starting to plan these cases. And when I say planning, what systems are you using? You've already scanned them. Walk me through now how you're designing your smiles.
Sure. So I'm either one of two ways. So I do an old school way where I take impressions and I wax them up myself. I know it, I've spent some time with the patient. I already have an idea of what I want them to look like. And sometimes, and we were talking about younger patients before. So oftentimes, and I really advocate for this, is doing really minimal dentistry, doing the least amount of dentistry you can to deliver what they want. So super conservative. So sometimes we're talking about doing just lateral incisors with indirect restorations and maybe some finessing of the smile with composite. We might be talking about doing, direct composite veneers using like the U-veneer system. We might be talking about microabrasion and whitening. So some of this doesn't need a whole lot of prep time. And other cases where we're doing full smile makeovers, that's going to take some prep time. And for those, I might do an old school wax up myself with my old waxing instruments back from, Pittsburgh back in the day.
Yep.
Or I also do a lot of digital smile design now. So I have a little studio in the office and I take some photographs, not just in the chair, but in the studio. And then I work with a digital designer and have models printed from that and stents made for prep guides and then provisional stents made. So either one of those two ways, we're preparing for the prep appointment. The patient's already committed to treatment. They've already made payment arrangements. And then the prep appointment is just like executing, right?
Right.
Yeah. So those are, that's how we get ready for that.
So let's go to the option 2 and what you're doing with digital smile design. Is this, so for example, are you working with your lab technician at that point or a specific designer through digital smile design? Walk me through that process for the audience.
For me, I'm working with my specific lab technician. Yeah, it's been a little bit of a learning curve for me, right? I've been out of dental school a long time. Switching to digital dentistry was something I knew I needed to do. I wanted to do. I want to stay on the cutting edge. I want to have all that available, but it's been a learning curve. So, and I also had to invest in the technology in the office. I had to get the digital scanners. I had to take some photography classes. I had to put a little studio in. And if we're doing implant work, which is also we're doing so much of that now, then I've got my CT machine. I had to have that in the office, my CBCT machine. And then we marry those together. So I just did a case on a 16-year-old boy that was I thought very interesting. So he was missing a bicuspid, a canine, and a lateral incisor, 5, 6, and 7. He had an impacted number 6. They tried to, open it up and pull it down orthodontically. And when that happened, he lost a lot of bone and then he lost the teeth on either side. So I didn't see him until after all this had happened. He already had a block graft in and he was ready to have some implants placed. So he comes to my office. We go through this process with his mom and dad, and this happened during COVID, and not post-COVID, right? Because we're still in the middle of COVID.
Hello.
So we do a digital scan, an iTero scan on him. I do a CBCT on my Prexion machine on him. And then I'm taking a bunch of photographs. And all that information goes to a surgical stent designer for me. But I also pull in my ceramist and the periodontist that's putting the implants in. So all 4 of us I send all that information out, all 4 of us get on a phone call, and then I'm verbally telling them where I want those teeth and how I want them to look. And at the same time, we're looking at the bone. Can the implants go there? Can we do the screw retained implants? The ceramist is saying what's possible for him. So it's a team effort. And I feel like we're getting the best possible outcomes that way. Then a surgical stent gets made and we take it from there.
And I would say this, My career was probably more cosmetic and it's involved more to implant surgery now and with my team and restorative implants. And I agree with you, Suze. I think everything is restoratively driven. You have to know the outcome. And especially with smiles and implants, if using cone beams and digital scanning and merging STL files with DICOM data, I really couldn't agree with you more, because if you know the outcome up front versus freehanding only leads to unfortunate surprises. So I really agree with you 100% on that. So because our viewers ask questions, and I love that, tell me payment policy. How do you work payment policy with a $25,000 case? How do you do it?
So if it's a straight up case in my office, say $25,000, we offer them a little bit of a discount if they pay it all at Records. I offer them a 5% discount if they're paying us by check at Records, 2% if they're paying us by credit card. We offer financing in the office. We have a couple different financing options, or we offer a third. We do a third at Records, a third at Impression, a third at Insert. And the insert is before they come back in the chair. So everything is always 100% paid before we put anything in.
And do you use, I'm just curious, Weave's texting service? Have you found that to be useful as far as patients paying? I had to ask. Talk to me.
I'm so glad you asked about that. Yeah, I love Weave's texting service. First of all, texting millennials, Gen X's, Gen Zers is the only way they want to communicate, right? Like, I don't communicate with them any other way. And I also communicate with them, after appointments. If we have long appointments, I can send a text and ask them how they're doing. They always answer. They always reply to their appointment confirmations. But the text to pay is pretty awesome. It's so simple. And I haven't used it a ton for these big cases, but for all of our regular stuff. They pay because, hey, here's the text, boom, it's paid right back to you. So it's been, my front desk girl is about my front desk manager is about 24 years old, and I don't think she talks to somebody on the phone all day, maybe once an hour. The whole rest of the day, she's texting people and just producing a lot.
We're big Weave users. We understand the world of texting, and I think the text to pay is one of those great additive features because it's all inclusive in the system. Yeah, I love it too. So let me just shoot forward. You said you're seeing younger patients, and openly is my practice. I'm not a younger practice. In other words, I see mostly patients 50 and above, and you're seeing now younger patients. We both practice, we try to practice minimally invasive dentistry. So tell me how that's changed your technique now when you're working with younger people versus, a 50-year-old who comes in with a lot of old composites, a couple crowns, and now you're working almost on virgin teeth routinely. Right. Tell me your approach. Yeah.
Right. It's really interesting. I see a lot of patients. I probably have 10 consults a week on people that are between 15 and 25 years old. And because they're driven by social media like the standard of beauty's changed. We all know this a little bit. They compare and despair with other people they see on social media, with all the influencers, and they want to look like that. And it affects their confidence, it affects their self-esteem, and it kind of affects the way they're out there in the world. And even though mature adult patients aren't necessarily diving into their cosmetics right now, they still want their kids to feel good about themselves, and they still want to launch their kids out into the world feeling confident.
You're right.
So they're still getting it done, right? So sometimes I see patients that have just left, like they've come from their general dentist and they're like, oh yeah, he told me I was fine, but I just don't like it. And it's little things. I'm always trying to be as minimal prep or no prep as possible. So if I could be completely additive with composite, whitening, icon, infiltration, microabrasion, that's a huge win for me. I'm also doing a lot of extremely minimal or no prep veneers, porcelain work, on younger people. It's making, I feel good about it. Like, I feel like I'm addressing their self-esteem, their confidence issues. I'm helping them feel great about themselves, but I'm also not changing their dentition in a way that's going to be harmful for them the rest of their life. We always, because, they don't, I think that they don't necessarily think long term when they make decisions like this. They're like, I want to fix,
Yeah.
I want to fix now. They're not thinking, well, when I'm 50, I'm going to have these redone, and what's going to be underneath there, right? So sometimes
Right.
I see them right from their general dentist. They just like their general dentist, said, yeah, you look great. And we all know that I think they might look great too. Like they have teeth that would have been considered a beautiful smile several years ago, but for them it's important. Right. And just because we say to them, oh, your teeth look great, it doesn't change their mind. So they keep seeking out until they find someone that can help them. And I also see people that are on their third consult sometimes. So they may have virgin teeth, they may have a little rotation in them, they may have a little like staining or color issues, or some translucency. And they've been told they need crowns. And they were going to get full cut crowns.
I know, unbelievable.
I know, and I have to think that the dentist that diagnosed that thought they were doing the best thing for them, because that's what they're used to. That's their wheelhouse. They're thinking they're addressing what they need to have addressed. But I'm really glad that they then turn up in my office and we can offer them like a minimal or no prep veneer situation instead.
Right. So I think to add to this, and you're not including it, but you do the services. You also do minimally invasive orthodontics. You do 6-month smiles. You do aligner therapy. So oftentimes I've worked with you. You're aligning the teeth to be also minimally invasive. Yes, a little bit added cost, but down the road, if they have their enamel for the next 60 years, that's all that's important to me. Your thoughts?
Completely agree with you, Lou. It's exactly right. I often will do like this. I love the 6-month smiles, clear aligners. We do Invisalign in the office. And I occasionally bracket people now too with that 6-month smiles kit. But aligning them pre-restorative can save their enamel. It does. Sometimes we have to convince them to do it because it adds 3 months, 6 months sometimes to the treatment time.
Agree.
And it adds expense too.
Yeah.
But it's
it
so much
does.
better.
But if you all I've done sometimes is I'll pull out some classic veneer cases of mine and show what a veneer preparation was 15 years ago. And they go, I don't want that done. I go, we're going to move some of your teeth. And I swear I'm not trying to do a horror show, but I really want the patient not to think when they're going to be 50, but I know they're going to be 50. And I'd love to have that enamel for that rainy day when they need that enamel. So I agree with you. So, okay, next question.
Okay. I love that. I love that idea of showing them a prep veneer. I don't do that. I'm going to steal that idea. That's awesome.
It's whatever. It works. Okay. But you're a marketeer, and I say marketeer out of pure respect. You were helping market my practice. You were marketing your practice. But you do a lot of cool things. So walk us through a couple things. What happens? What do you do the day of a delivery? How do you market that experience? And then for the last part of this interview, what I'd love you to do is talk to us then about other social media, what you're doing on your website, because you're still on my website. I'm not taking you off my website, even if you're not in my practice. But tell me, don't sue me, but tell me what happens the day of a delivery, or do you bring them back a week later? And then how are you marketing? Go.
Okay, so the most important transition period in these smile makeovers is the provisionalization day. So if we're doing veneers, I'm prepping them, and putting them in provisionals that are a prototype of what I want. And that's where the big change happens. The spaces are being closed, things are being rotated. And so when we have mirrors on the wall in our office, I don't hand anybody a face mirror. I want them to stand up and look at whatever I've done from 3 feet away. I have mirrors on the walls and I have benches in front of the mirrors. So they cannot get too close to those mirrors. Because when you look really close, it's not necessarily an accurate representation of what you see, of what's there, of what other people see. So they look, and so as soon as we're done with provisionalizing them, I'm satisfied with them. Or if it's it's like a direct veneer case, as soon as we're done with the actual work, I set them up and I ask them to take a look in the mirror. And we always have someone ready with a camera phone shooting the video. I want to record their responses. And they don't know that they were there because you only get one shot at this. There's only that one oh my God, I like the way it looks. And then after we shoot it, we ask them, then usually there's hugs and kisses and, where everyone's happy. And when that happens, we say, hey, we shot this video of you. Is it okay if we use this, in my lectures for some social media marketing? And most of the time they are 100% okay with that. And we also send it to them because we want them to post it on their stuff. So you have to catch it. You have to get content. And that's a great way to get content because it's super meaningful and people see raw emotion and they respond to it. So we do that. And then of course I take befores and afters. And after we're finished with a patient, so they get, so that's the provisional, then we get it done in the finals. We shoot video again in finals, but the real emotional ones happen at the provisional appointment. And then we post-op them and we have them back for their final photos. And in the studio, we take their final photos. But at that appointment, we always kind of ask them if we can take some pictures on their phone. I have in my office some big murals, some big pieces of art, and we've all seen those Instagram photos where people stand in front of the wings and then they put it in their own Instagram and it sends it out to everybody they know. So we have some art that's Instagram worthy, if you will. It's big. I have a picture of some huge birds, and if you stand just the right way, it looks like a bird's on your head. Otherwise, you can hold it in your hand. There's some butterflies. There's some flowers that look like a big headdress. And we switch this art up every once in a while. So my younger staff members will say, hey, do you want me to take a picture of you in front of the birds? And it will show them other people that have posted it. And we use their camera their camera to do it. We say, give me your phone and I'll take the pictures. And then if you post this on your Instagram, would you just tag us? Because that is the best way to get referrals from their people in their age group, is them posting about their experience on their Instagram. And you also have to have, and then they tag us and you have like 20 seconds when one of their friends looks at that's cool, and they hit, our link and come back to my Instagram page. They have about 20 seconds to look at your Instagram page and decide whether or not you're cool. So you have to work on your Instagram page a little bit and make sure that you've got original content on there, that you've got some things that might look cool. So you don't look like every other dentist office. You're just not, my Instagram is at Smiles in the City, and I've worked really hard on it. And if you scroll back, you'll see how it used to look. Yeah. It used to look lame. It used to look like every dentist. And now I think it looks a little bit more appealing, and we're getting, we have a pretty decent following for that. And then if they follow you, each time you post something, that new person that already knows the work you did on their friend is seeing what you did. So it's generating a lot of referrals that way. And I'll also text them the before and after pictures, and they'll post those along with that sometimes too. And then I've had people that just every time they take a smile, they'll tag me in it. And that's the powerful and free marketing.
Wow.
Yeah.
Wow. What a compliment, Suze, when they text you or share that family moment with their smile. I mean, to me, I just get the chills on that. Don't you?
Oh, it's what I wake up for every day. It makes me feel great. It makes me feel like I'm doing important work.
I know.
Yeah.
So as I close this, here's what I want everybody to understand. You just got about 40 tips and tricks in these two short interviews, about 40. So in October or November, Susan is going to be doing a virtual Friday. And what Midway and Catapult are doing is we're coming together, and Susan is going to be either sharing the podium with, I hope, Joyce, and we're going to bring the best of the best of really more of these pearls and tips and tricks, literally, on cosmetic dentistry. So you'll be seeing this on our educational front. It'll all be online. And then next year, I'm going to have Susan do a whole subscription on veneers and cosmetic dentistry, and it'll be in separate modules. And I'm telling you, if you've loved this interview as much as I love Susan, you're going to just get so much out of those modules, 1 through whatever. Susan, I can't thank you enough. My audience is already going back to listen to the tips again. You're the best. Love you. Thanks so much for being here.
Hey, Lou. I love you too. Thank you for having me. It's been really fun. I hope to see everybody in October.
Thank you. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.